Among the many dietary patterns studied for their impact on cancer prevention, the Mediterranean diet has consistently stood out, not just for its nutrient profile, but for its broader lifestyle context. Based on the traditional eating habits of countries like Greece, Italy, and parts of southern France, this diet has been the subject of extensive epidemiological and clinical research, with results pointing to a compelling association between long-term adherence and reduced cancer risk. While no single diet can guarantee protection, the Mediterranean approach appears to offer a particularly strong defense when it comes to cancer incidence and survivorship, making it a potential gold standard in preventive nutrition. Large-scale cohort studies, including those within the European Prospective Investigation into Cancer and Nutrition, EPIC, and other multinational efforts, have consistently shown that individuals who closely follow a Mediterranean dietary pattern have lower rates of various cancers, particularly colorectal, breast, gastric, and prostate. The protective effects are believed to stem not from one food or nutrient, but from the combined influence of multiple synergistic components. These include a high intake of vegetables, fruits, legumes, nuts, and whole grains, regular use of extra virgin olive oil as the primary fat, moderate consumption of fish and poultry, minimal red meat, and modest amounts of red wine, typically enjoyed with meals. Olive oil, a cornerstone of the Mediterranean diet, is rich in monounsaturated fats and polyphenol that have been shown to reduce inflammation and oxidative stress, both of which play critical roles in cancer development. Whole grains and legumes provide fiber that supports a healthy gut microbiome, enhances detoxification pathways, and regulates estrogen and insulin levels. Fresh produce contributes an array of antioxidants and phytonutrients that may suppress tumor-promoting pathways. Even moderate wine intake, especially red wine consumed in social settings, may offer cardiovascular and metabolic benefits, though the role of alcohol in cancer risk remains complex and highly dose-dependent. Yet the Mediterranean diet is more than a checklist of foods. It represents a broader lifestyle that may itself contribute to health outcomes. Meals are typically consumed slowly, with others, and as part of a regular daily rhythm. This pattern of social eating and reduced mealtime stress is thought to benefit digestion, hormone regulation, and even mental health, all factors increasingly linked to cancer risk and resilience. The diet also encourages physical activity, sunlight exposure, and strong social bonds, reinforcing the idea that cancer prevention is not solely about what is eaten, but how life is lived. That said, it's important to avoid romanticizing the diet or assuming it is universally effective without context. The benefits observed in traditional Mediterranean populations are tightly interwoven with factors such as food quality, community engagement, and physical labor, elements that may not be replicated simply by importing the diet into a different cultural or commercial setting. In today's globalized food environment, even a so-called Mediterranean diet can become distorted, filled with processed grains, low-quality oils, and commercial wine, undermining its original integrity and protective effects. Additionally, while the diet's anti-inflammatory and metabolic benefits make it a strong candidate for cancer prevention, it is not a cure or a replacement for medical treatment. Nor does it eliminate the need for personalized care. Certain cancer survivors or patients with digestive disorders, food intolerances, or comorbid conditions may require adaptations to the standard Mediterranean template. And while moderate alcohol intake is traditionally included, it remains a controversial component, especially given the link between alcohol and cancers of the breast, liver, and esophagus. For some, particularly those at higher risk, omitting alcohol altogether may be the wiser path. Despite these nuances, the Mediterranean diet remains one of the most evidence-backed approaches for reducing cancer risk through diet and lifestyle. Its strength lies in its balance, rich in nutrients but not restrictive, structured but not rigid, socially rooted but adaptable. In a world flooded with extreme dietary trends, detox myths, and supplement promises, the Mediterranean pattern offers something more grounded, a sustainable, pleasurable, and culturally embedded way of eating that nourishes the body without demanding perfection. For those looking to lower cancer risk without falling into the traps of nutritional extremism, it may be the most realistic and protective approach currently known.